Hare Krishna, dear devotees.
Hare Krishna.
Hare Krishna.
Hare Krishna, Kavita.
Hare Krishna, Paravali.
Please
Hare
accept my
Krishna.
humble obeisances. Hare Krishna, Radhana. All glories to Srila Prabhupada.
Hari Hari Bol.
Hare Krishna. Nice to see everyone. Just waiting for a couple of more people to join and we'll start. I hope the time change didn't confuse people so much.
Mhm.
Try to message in advance in the group. Is it the same? Is it the same time for like other devotees, or is it different now?
We don't change our clocks
Okay.
in this province, so but your time has changed. So yeah, it is an hour. It's an hour later than last week.
Oh, so what time is it there now?
It's 11 o'clock.
Okay. All right. I hope it's gonna still be okay.
Yeah, no, it's fine, Mataji, and you gave really nice directions. Like you're letting us know in advance. So
That's great.
Hare Krishna, Taravali
Hare
Mataji.
Krishna Vatsala, how are you?
Okay, good. So far, so good.
Nice to see you again.
Nice to see your smile.
Nice to see you too. Okay, I think we can start if that's okay with devotees. I see the same familiar faces. I don't think we need an introduction. So I think we can begin if that's okay.
Yeah,
Yeah?
yeah.
All right, great. Let me just share the screen. I think this is where we stopped. Can you see the screen? Yeah?
Okay.
Yeah, this is
Yeah.
where we stopped last time.
Mm-hmm.
Is there anyone who would like to begin the reading?
I can, Mataji.
Sure, let's go.
Okay, I'm working off of an iPhone, so it's quite small. Please accept my humble obeisances. All glories to Srila Prabhupada and Sri Guru. Hare Krishna, everybody. Okay, communicating with one who is dying. Be sure the patient wants to talk with someone. It is not always easy or comfortable speaking to someone who is terminally ill. Even the most well-meaning intentions can go awry when we approach a patient thinking he wants to engage in a deep conversation about his situation, only to find he does not. Often the patient is physically tired or just has had an intense conversation that has left him emotionally exhausted. He simply may not be in the mood to discuss something so multifaceted. At times he may feel frustrated, thinking no one can possibly understand what he is going through. This frustration may lead to angry outbursts. Even the most well-meaning friend or family member can seem like an intruder to the patient when he does not wish to engage in an intense conversation. Although a terminal illness affects everyone associated with the patient, ultimately it is the patient alone who is facing what seems to be an untimely death. Even a devotee needs to go through a kind of mental processing period to come to terms with her life being suddenly cut short. Discussing her situation with someone may or may not assist her in this process. How she spends her last remaining days, searching for conclusions, will be her choice and her right. As a caregiver, you need to remind yourself and others that the patient will most likely want to talk at another time. For now, ask her if she wants to be alone. If so, allow her that simple comfort. If she states that she does not want to be alone, but does not want to engage in conversation either, ask her if you can sit by her side without speaking. If you feel at ease with the silence, so will she.
Will anyone else like to continue?
I can read, Mataji.
Sure, thank you.
I'm reading from the book, okay?
Sure.
Concentrate on the patient, not on yourself. Can you hear me?
Yes.
Often, when having a conversation, we seem to be listening to what the other person is saying, but do not really hear him. This may occur because we are preoccupied with our own responses or because we are looking for what we want to hear. The latter frequently occurs when speaking with a terminally ill patient, especially one we care about very much. As a caregiver to a devotee, you will naturally want your patient or loved one to reach the Krishna conscious conclusions you feel he needs in order to obtain spiritual peace. We may be so anxious for the dying devotee to have the realizations we desire for him that we do not truly hear what he is actually expressing. Spiritual awareness must be nurtured, never rushed. Allow your listening to facilitate another's communication. Let your attitude reflect the privilege of listening. Hear what he is trying to communicate to you and not what you want him to say. Avoid giving advice unless you are asked. When speaking to a terminally ill patient, it is not recommended to begin a sentence with, "If I were you, I would." This may very well put a halt to your conversation. The patient may respond by saying, "But you are not me," and he would be justified in responding this way. After all, we cannot fully comprehend what a dying person is experiencing. We can empathize, but until we are in a similar situation, it is difficult to fully understand. Still, we can try to put ourselves in the place of the patient, always reminding ourselves to separate our needs from his. If we are asked for advice and do not know what to say, be honest. Tell him what you do not truly understand what he is experiencing. If you would like to offer advice, you may want to begin your suggestions with a sensitive phrases like, "Have you ever considered?" or "What do you think about?" Perhaps the dying devotee does not want advice. He knows what he must do. He may simply want the comfort of knowing that someone understands his unique pain. Reassure the devotee that his life has made a difference in the world. As previously discussed, every person deserves to feel that his life has had meaning and worth. He needs to know that he has contributed something valuable to the world, to his family members, to his friends, and to his God brothers and God sisters. As a devotee, your patient has made more of a difference than he probably realizes. Remind him that he will not be forgotten by family, friends, or by the society of devotees. Speaking from the heart, tell him that you are a better person and a better devotee having known him. If you do not tell him now, you may never have the opportunity again.
Can I say something quickly?
Of course.
This is
Okay.
Sangeeta.
Right.
I
Hare
think
Krishna.
this is a really important point that every person in this world, especially devotees, need to understand that they've made a difference somehow by by just living in this world and being a devotee, by being Krishna conscious, by trying to help Lord Chaitanya's Sankirtan movement, by trying to help Srila Prabhupada in his mission. So it might be uncomfortable for some people to even some devotees I've seen, it's might be uncomfortable to express these things, but the more you do it, the easier it gets. And then you'll learn how to express your gratitude for one another, not just when somebody's dying, but all through life. It's a really wonderful thing to do, is to express your gratitude for having known someone, or just every day, every day. Why not? Why not tell somebody, you know, I love the way you do such and such. You know, I love the way you make blueberry halava. That's the best blueberry halava I have ever had. And you make it the best. You know, whatever it is that you see so wonderful about somebody, tell them that. Because, you know, you never know. Even if somebody isn't terminally ill, you know, we could die at any moment. We could cross the street and be hit by a big bus. We don't know. I mean, God forbid, but you know, we don't know what Krishna has in store for us. So it's a good habit to get into, is to show our appreciation, our gratitude for one another in our society of devotees, and just in general, you know, just to be like that. People love to be around people who are positive and and uh you know, if you express that in your conversations with people. Wow, that was great how you just said that. That was an amazing kirtan that you led. That was such an amazing class that you gave yesterday. I was so inspired by it. You know, just the smallest thing, you know. I love the way you child like that. That's so important to do that to children, you know. It's amazing. So that's what this is about. Don't wait for somebody to be dying to express your appreciation of him or her. Let's try to do it every day. Okay.
Thank you. Such an important reminder.
Okay.
Let anyone else like to continue?
But I didn't mean to stop her from reading, so
Yeah,
can you continue?
Karuna Purna Shakti Mataji.
Yes. Be prepared to cover the same subject matter again and again. Sometimes a terminally ill patient may need to verbalize the same thoughts, realizations, anxieties, or fears many times before she can move on. Do not feel guilty if you feel a little frustrated, as hearing the same points repeated over and over again by your patient. She may even need to hear you repeat the same answers you have told her many times before. Although this repetition can be worrisome to the caregiver, it is sometimes necessary for the patient. Those who are coping with tremendous emotional stress may need to repeatedly cover the same subjects until they are comfortable with their conclusions. Helping someone who is dying can be both humbling and exhausting, but it is the most valuable thing you can ever do for someone. Remember to paraphrase the patient's statements. This technique involves stating in your own words what you think someone just said. Paraphrasing reassures the patient that you are not only listening to what he is saying, but you are truly attempting to understand him. You may want to start a sentence by saying, "What I hear you saying is," or "in other words," or "so what you are telling me is." Use this technique whenever the devotee says something that seems important to him, and he will appreciate your effort to understand him. Don't be afraid to ask important questions. If you feel your patient wants to talk about her situation, but feels awkward getting the conversation started, you may want to ask some of the following questions. What is this experience like for you? How is your family reacting to this? Are you feeling afraid? How can I help? How do you want to spend this time? Do you have any regrets or unfinished business? Can I help you arrange anything? Do you want anyone in particular to visit you? What have you learned from all of this? What spiritual realizations have you had since being diagnosed? If the devotee reacts as you have invaded, if the devotee reacts as if you have invaded his privacy by asking some of these questions, you can always apologize and back away from these sensitive issues. He may not be ready to discuss these things, or discussing them at another time might be more appropriate.
Thank you. Anyone else would like to continue?
Hare Krishna,
Hare
everybody.
Krishna, Greg. Hare Krishna.
I'd like to read for a little bit.
Please, thank you.
Thank you. Remember the importance of non-verbal communication. Although a person may articulate something, his or her body language may convey a different message. Body language can be described as clusters of signals that convey information. Often, when words and body language are different, the non-verbal message is what is communicated. He told me he had read the book. I didn't believe him. Also, non-verbal signals are interpreted differently according to cultural variations. Below are some non-verbal clues that may decrease communication. Poor eye contact, looking away or closing eyes for more than a second. Body turned away, which depicts disinterest. Feet turned away, standing depicts disinterest. Sitting behind a desk or other barrier depicts wanting to distance ourselves. Holding a barrier in front of the body, if standing depicts wanting to distance ourselves. Arms folded across the chest depicts defensiveness or wanting to distance ourselves. Clenched fists depicts anger or defensiveness. Shifting weight from one foot to the other depicts awkwardness. Rubbing neck depicts criticism. Fidgeting with clothes or other objects depicts nervousness. Peering over eyeglasses depicts a judgmental attitude. Wringing of hands depicts nervousness or frustration. On the contrary, we can send powerful positive messages with our body language. For example, sitting down with someone on his or her physical level shows you care and are interested in what's being said. Leaning slightly forward indicates that you are giving him your complete attention. Similarly, we tend to turn towards something or someone who interests us. Nodding while she is speaking will show you understand what she is trying to convey. It does not always mean that you necessarily agree with the speaker. Touch, when used appropriately, can send a message of caring and support. It also improves trust between the patient and caregiver. A light touch on your patient's hand, for instance, can communicate empathy when he may need it the most. Several studies have shown that touch can have strong therapeutic value, can offer psychological and physical comfort. I've had patients, however, that experienced such excruciating pain that even a light touch on the hand hurt them. Be aware of what your patient can tolerate. Touch is also interpreted in various ways according to different cultures. A warm smile is universal and always suggests kindness and compassion.
Okay, we're starting a new chapter. Terminal illnesses. Would anyone else like to continue? Oh, Sangeeta Maj, I think you're muted. You're trying to say something, but
Okay.
yes.
Yeah, I said I lost my glasses last night, but I'll give it a try.
Oh, I'm
Okay.
sorry.
All right, unless somebody else wants to read.
I think Aradhana put up her hand.
Okay,
Yeah.
great.
Hare Krishna.
Hare Krishna.
Please accept my humble obeisances. All glories to Srila Prabhupada.
Krishna
Terminal illnesses. In this chapter, many diseases are discussed, which at their end stage are considered terminal and hospice appropriate. This discussion only briefly refers to some terminal illnesses and is not meant to be all inclusive. It is, however, meant to prompt further inquiry by the reader if desired. Acquired immune deficiency syndrome, AIDS. Acquired immune deficiency syndrome, AIDS, is a syndrome of opportunistic infections that occur at as a result of uncontrolled spread of the human immunodeficiency virus, HIV. When the virus is uncontrolled, these opportunistic diseases can invade every system of the body and eventually cause death. The Center for Disease Control and Prevention, CDC, first described the virus in 1981. HIV is spread by intimate sexual contact, contaminated needles or blood products, or from mother to child. Blood products are now routinely screened to prevent transmission of the virus through blood transfusions. When contracted, HIV attaches itself to cells in the body, specifically the CD4 receptors of T cells. T cells are lymphocytes, white blood cells that fight infection. HIV can infect other cells with CD4 receptors as well. Once attached, the virus then enters the cells, infiltrates the ribonucleic acid, RNA, transfers its deoxyribonucleic acid, DNA, to the cells.
Good. That was really good.
To the cells and prevents the cells from performing their normal function. With the transfer of its own DNA, the virus can then replicate. Diagnosis of HIV is determined by a simple blood test that detects antibodies that the body naturally develops to fight the virus. Antibodies to HIV can usually be detected approximately 2 to 6 weeks after exposure to the virus. Early symptoms may include mild fever, muscular pain, joint pain, weight loss, and rash. Even when an HIV-infected person has no symptoms, he can still infect others and should be under the care of a physician. Highly active antiretroviral agents, viral agents,
Antiretroviral agents.
viral agents, HAART, medications introduced in 1966 to fight HIV have greatly reduced the number of opportunistic infections contracted by HIV-infected patients. Each type of drug works on a different part of the replication cycle of the virus. When taken in combination, they have proven to suppress viral replication for long periods of time. In a 1996 issue of the New England Journal of Medicine, it states, the goal of antiretroviral therapy should be to reduce levels of circulating virus as much as possible for as long as possible. For those who have access to these medications and are able to follow a strict daily regime, the HIV infection has now become more of a chronic long-term disease. It is important to note, however, that these medications are not a cure for HIV or AIDS, and those undergoing these medication regime may still develop infections. They also have not been shown to eliminate the risk of passing HIV to others through sexual contact or blood contamination. Those who are undiagnosed, untreated, not properly treated, or those for whom antiretroviral viral therapy has failed are still at risk of developing many of the opportunistic infections long associated with AIDS. The development of these opportunistic infections, as well as the number of T4 cells in the body, signals the difference between being HIV infected and having AIDS. Those patients who do not comply with their medication regime, those who do not have access to HAART, H-A-A-R-T, and those in third world countries are at additional risk for developing AIDS. There are many opportunistic illnesses that can compromise the health of a person infected with HIV. The ones listed below are among the most common.
Anyone else? Yes, later Premataji.
Hare Krishna, everyone.
Hare Krishna.
Pneumocystis cystis carinii pneumonia, PCP, a lung infection caused by an organism found in air, food, and water, is the most common lung infection found in patients with AIDS. Symptoms include fever, fatigue, shortness of breath, and persistent cough. An HIV-infected patient with a T4 cell count below 200 has an increased chance of developing PCP. Toxoplasmosis, a disease of the brain caused by an organism found in, among other sources, vegetables and unpasteurized dairy products. The illness can be transmitted from mother to fetus through the umbilical cord if acquired during pregnancy. This disease affects the central nervous system, CNS, causing headaches, seizures, confusion, memory loss, one-sided paralysis, visual defects, absence or impairment of speech, and impaired muscle coordination. Mycobacterium avium intracellular MAI infection. This infection is caused by bacteria found in soil, air, water, raw dairy products, and other environmental sources. It rarely causes infection in healthy individuals, but in a person with AIDS, it may affect the blood, lymph nodes, bone marrow, liver, lungs, and gastrointestinal tract. Symptoms often include fever, severe diarrhea, weight loss, fatigue, fever, abdominal pain, and night sweats. Herpes simplex virus. This is a chronic infection caused by a herpes virus and is commonly seen in patients with AIDS. Herpes simplex 1 is spread through oral secretions. Symptoms include painful blister-like lesions on the lips, tongue, or inside the mouth. In patients with AIDS, lesions may spread to the esophagus, trachea, and lungs. Herpes simplex 2 is spread through intimate sexual contact, causing lesions in the genital area. Other symptoms can include fever and fatigue. In patients with AIDS, this infection can cause complications such as bronchitis, esophagitis, inflammation of the esophagus, pericarditis, inflammation of the sac that encloses the heart, and encephalitis, inflammation of the brain. Cytomegalo, cytomegalovirus, CMV infection. CMV is one of the herpes viruses. In patients with compromised immune systems, it can affect the lungs, central nervous system, eyes, gastrointestinal tract, adrenal glands, and blood. Symptoms can include fever, swollen lymph nodes, enlarged liver and spleen, stomach and intestinal ulcers, and blindness. Candida albi, how do I pronounce the albicans infection? This is a disease caused by a fungus. It's most commonly found in the mouth, throat, and esophagus. It is characterized by the presence of white patches in the mouth and difficulty swallowing. This infection is common among patients with AIDS. Progressive multifocal leukoencephalopathy, PML. PML is an illness infecting the central nervous system. It is caused by the Papoa virus and causes gradual brain degeneration. Symptoms can include confusion, headache, seizures, visual loss, weakened limbs, speech disturbances, and lethargy. In advanced stages, it can cause partial paralysis and coma. Do you want me to continue, Chiravali, or would you like to give an opportunity to somebody else?
We can ask if there's anyone else who would like to read. Guess you can continue.
Okay. Alzheimer's disease. In general, many people do not think of Alzheimer's disease as a terminal illness, but in its final stages, it's considered a hospice appropriate disease. It is the most common cause of dementia, a progressive condition causing, among other things, intellectual impairment, memory loss, apathy, and speech disturbances, contributing to about 50% of all cases. Because it is progressive, prognosis is poor. Duration of the disease generally lasts from 3 to 20 years, with an average of approximately 7 years from diagnosis to death. It's rarely seen in patients before 45 years of age. Alzheimer's disease causes irreversible damage to brain cells, causing early symptoms of short term memory loss, forgetfulness, inability to concentrate, difficulty learning new information, and often deterioration in personal hygiene. In its later stages, Alzheimer's disease may cause deterioration of long term memory and communication, including spoken and written language, repetitive actions, urinary and fecal incontinence, and personality changes, including extreme agitation that can lead to violent episodes. In its final stage, patients with Alzheimer's disease often stop eating and drinking, leading to dehydration and starvation. They are also at high risk for infections, a major cause of death. Because of decreased mobility, many patients are at risk for decubitus ulcers, sometimes referred to as bed sores or pressure sores, usually occurring over bony areas of the body. Decubitus ulcers can begin with superficial skin maceration or become deep enough to expose muscle and even bone. Meticulous skin care, as well as frequent repositioning of a patient with Alzheimer's disease, at least every 2 hours round the clock, is essential to help avoid such ulcers. Being a caregiver of a patient with Alzheimer's disease can be physically and emotionally wearing. Caregivers require a great deal of support from family and friends with regular relief for rest. The cause of Alzheimer's disease is still unknown, although research is ongoing. New medications are now available that can slow its progression in some patients who are in the early stages of the disease. However, the illness still remains irreversible. Diagnosis is difficult. Tests involve physical and neuropsychological testing, which tests memory, reasoning, language, ability, and vision motor coordination. Often a psychiatric evaluation is done. A magnetic resonance imaging (MRI) study of the brain is used to search for other possible reasons for dementia, such as a tumor or a stroke. Blood tests are also performed. As of this writing, a definite diagnosis of Alzheimer's disease cannot be made until autopsy because microscopic examination of brain tissue is required. Some families choose to have this performed after the patient's death as a means to provide family medical history. Thank you, Thoroughly.
Would anyone else like to continue? We have a few more minutes.
I can continue if you like me to continue, if nobody is there to read.
I can read.
Sure.
If you're tired, Mataji, I can read.
Yeah,
Thank you.
sure, please go ahead.
Okay. Amyotrophic lateral sclerosis. Amyotrophic lateral sclerosis, ALS, was first written about in the late 1800s, but became known as Lou Gehrig's disease in 1939 when the famous New York Yankee showed great courage after being diagnosed with the illness. ALS is a neurological disease caused by the degeneration of the upper and lower motor neurons in a part of the brain called the medulla oblongata and the spinal cord. It leads to progressive muscular weakness and the inability to speak and eventually to swallow. The disease progresses rapidly in some patients and slowly in others. It often begins in the limbs with muscle weakness, but can start with speech and swallowing difficulties. The incidence of onset is usually between the age of 50 and 70. It is rare under the age of 30. ALS leads to quadriplegia, paralysis of all limbs, and to a loss of speech, swallowing, and eventually the ability to breathe. Patients with ALS usually remain mentally alert through their illness since it does not affect intellect. Similarly, ALS does not affect eyesight, hearing, or bladder and bowel control. It can sometimes affect emotions, causing a patient to laugh or cry at inappropriate times. The life of an ALS patient becomes extremely limiting and often frustrating since complete care, such as bathing, dressing, feeding, turning, and lifting, is eventually required. It is essential that the primary caregiver be relieved at regular intervals in order to receive adequate emotional and physical rest. When the patient can no longer speak or move his limbs, communication becomes difficult. Boredom and loneliness are common. Communication devices such as a word board or picture board can be helpful. A caregiver points to a word or a picture while the patient blinks his eyes to confirm. This system can be tedious but effective. I once cared for a young man with ALS who wrote an entire book of poems using a laptop computer and a special device that was clipped to his eyeglasses. He blinked on each letter, then typed itself onto the screen. In this way, the gentleman of 46 years of age, determined to leave something behind after his death, patiently typed each word of each sentence and eventually wrote an entire volume of poetry. The average prognosis is 2 to 5 years after diagnosis, although I cared for hospice patients who died after having ALS for 8 to 10 years. In the patients who choose palliative care at the end stage of this disease, death usually occurs from respiratory failure. When the patient chooses aggressive treatment, such as the use of a ventilator, death usually comes from pneumonia. Initial symptoms may include slurred speech, uncontrolled drooling, hand weakness, muscle twitching, poor balance when standing or walking, causing frequent falls and shortness of breath on exertion. Diagnosis is made after the physical examination, study of clinical symptoms, and exclusion of other possible causes for the symptoms. More invasive testing to confirm a diagnosis of ALS may include electromyography, blood tests, nerve conduction studies, and muscle biopsy, and examination of cerebrospinal fluid. Haribol.
I think we have time for this one more section. Cancer. Anyone else would like to finish off today's reading session?
I can do it, Prabhu. Mataji.
I think Sangeeta Mataji is saying something. Muted. You're muted, Sangeeta Mataji.
Yeah, Vatsala, you want to read?
Yes,
Okay,
Sangeeta Mataji.
it's my Vatsala.
Thank you. Cancer. There are an estimated 200 different types of cancer. All forms of cancer involve the uncontrolled growth of abnormal cells derived from normal tissue. Even when discovered in its early stages, these cells may or may not spread. When they do spread, it is called metastasis. Unfortunately, many cancers remain silent with few or no symptoms at first. So, by the time they are discovered, they may have already metastasized to other parts of the body. Benign tumors are not cancer. They can usually be removed and, in most cases, do not return. The cells in benign tumors do not spread and therefore are not life threatening. On the other hand, malignant tumor cells are cancerous and can break away from the original tumor. Normally, cells in the body grow, divide, and eventually die in a systematic order. As we reach adulthood, the process slows and most cells divide only to restore worn out cells or to repair injuries. Cancer cells continue to grow and divide, however, and when gathered together, form tumors that invade normal tissue. When cells break away from the original tumor, they can travel through the bloodstream or the lymphatic system. They are then free to compress and invade other parts of the body, including major organs. Even when a particular type of cancer has spread, it is still referred to by its original or primary site of growth. For example, if a patient has breast cancer that metastasizes to these lungs, it is still called breast cancer or metastatic breast cancer. Various types of cancer cells differ in their growth, pattern of spread, and response to treatment. Pain caused by various types of cancers responds to different pain medications as well. For instance, when or what alleviates pain for some patients with bone cancer may not be effective for someone with bladder cancer. Staging refers to the extent and prognosis of the tumor. There are many staging systems of cancer. A common system is the tumor node and metastasis system, TNM, that adds numbers to each of these categories depending on the distribution of the cancer cells. Some important warning signs of cancer to be aware of are unusual bleeding or discharge, either internally or externally, any lump or thickening, a sore that does not heal, a significant change of bowel or bladder habits, a persistent cough or hoarseness, difficulty swallowing. The appearance of a new wart or mole, or a change in size and shape of an existing wart or mole. Unexplained weight loss. Any of these signs should immediately be brought to the attention of a physician. Diagnosis is made by various means, such as biopsy, computerized tomography, CT scan, mammography, or ultrasound, depending on the site of the suspected cancer. Motherji, do you want me to go? Or
I think we're out of time now, so we'll thank you so much.
thank you.
That's a lot. We will continue next week. So we'll have one more reading session before we have our Q&A session with Sangeeta Mataji. So something to look forward to. And also we wanted to let everyone know that we are planning about a 1-hour workshop in the beginning of December on what not to say to a grieving devotee. So that's going to be a very interesting topic. And so something to look out for. We'll be sending information soon. And we'll also be sending information about the Q&A session. But for now, I think that's it for today. Thank you so much, everyone. And we'll open the chat again for a couple of hours. If you have any questions, please write there. We always love to hear from you and feedback or any reflections. And Sangeeta Mataji, please let me know if I missed anything.
No, I think that's it. Thank you.
Yeah, thank you so much, everyone, again, and looking forward to seeing your beautiful faces next week. Happy
Thank you.
Thank
Hare
you,
Krishna.
Mataji. Hare Krishna, everybody.
Hare
Hari
Krishna.
Bol.
Thank
Hari
you.
Bol.
Thank you,
Thank
everybody.
you.
Everybody.
Hare Krishna.
Have a great week. Hare Krishna.
Hare Krishna, Mataji.
Hare Krishna Prabhu.
Oh, Greg, I see the question. Please ask the questions in the chat, okay? In WhatsApp. Thank
I
you so
will
much.
do. Okay.
Good.
Hare Krishna.
Hare Krishna.